This is Patricia Roy at University of San Diego, and I am proposing an Apple Watch with audio-visual cardiac monitor. In the world of healthcare, where technology enables the daily functioning of delivering safe and quality patient care, it is important to understand the needs of both clinicians and the patients. Telemonitoring has been suggested to improve the medical outcomes. In cases of cardiac patients, early signs and symptoms help in the prevention of hospitalization. A telemonitoring gadget will always be an efficient tool to interact and communicate remotely and understand a patient's condition in detail clinically. Feasibility of remote monitoring of patients help in detecting critical symptoms of cardiac issues. It helps in the detection of cardiac-related illnesses like cardiomyopathy, heart failure, angina pain, and many more. When the process can be done remotely, it helps the clinicians with better output. Research study that ran a trial with 1653 patients included recent hospitalization for heart patients. It proved telephone-based interactive voice response device can be an important tool to assess patients non-invasively. It would be convenient to have an Apple Watch with an audiovisual screen that can be connected to any USB port and have access to a clinician immediately. The audiovisual screen will also be able to monitor the vital signs like blood pressure, heart rate, respiration, oxygen saturation, and pain. It will determine the early signs of heart attack like chest pain, jaw tightness, muscle discomfort. On the other end, a monitor display can help in the process of communicating between the clinician and the patient. The clinician and the patient can also input data electronically. It will help in documentation of the patient's condition and the purpose of interaction, visibility, and assessment of remote patients. An Apple Watch that can have the ability to do clinical assessments on a patient helps in having an integrated communication among clinicians. It can help in having better access to the process of knowing details beforehand and avoid time on making physical communication.